Health equity is the notion that people of all walks of life should have the same opportunity for a long and healthy life. While we have universal access to healthcare in Canada, I think it's also important to remember that there are many other important factors that help shape our health directly by conditioning and constraining our lifestyle choices, like whether we smoke or drink a lot, or what our diet looks like, or how much we exercise. These are factors like our education, our housing conditions, the hazards and resources in our neighborhoods, our employment conditions, and our income. We as a society should make an effort to provide access to adequate social infrastructure throughout life to help level the disadvantages that are inherent in some of the unique contexts and circumstances that we live our lives in. Health in all policies is a so-called whole-of-government approach to tackling health, and importantly, health equity. And by whole of government, I mean that it requires all of the sectors in government, including ministries that may not have a direct interest in health, to collaborate on how they go about doing the business of planning, financing, and evaluating the health system. So, for example, we know that major roads and highways deposit large amounts of harmful pollutions into the immediate neighborhoods. The Ministry of Health might work with ministries concerned with transportation and ministries concerned with infrastructure to systematically screen all decisions about which roads are going to grow in size, where to site new highways, to ensure that human populations are adequately protected. In other words, it's the recognition of governments that health is broader than just health care, and that's really what's innovative. Now, many governments will say that while they're interested in fostering more healthy, equitable societies, they don't have any evidence for how to go about doing that. But the truth is that many governments around the world have gone ahead and tried out different health and all policies approaches. So I'm interested in learning about how and why action has been taken in other settings and what the results were, so that we can start to come up with examples, evidence, and advice for governments who do want to foster health equity.